This video is one of a series of personal support worker videos that demonstrate the skills needed for the role of the support worker. It is understood that there are multiple ways to carry out these specific demonstrations. The premise of these videos were that we would use skills that are safe, ethical, and also include best practices. We hope you enjoy and of course learn something. In this video, 3 integral procedures related to maintaining infection control will be demonstrated. Hand washing, using a hand sanitizer, and donning and doffing personal protective equipment, or PPE. As healthcare providers, it's important to protect the health of your clients. By performing hand hygiene and using appropriate protective equipment, you will prevent the spread of microbes. If hands are visibly soiled, they must be washed with soap and water. If hands are not visibly soiled, it is okay to use alcohol rub or hand sanitizer. Gather your equipment and supplies. In this case, a sink, soap, paper towels, and a garbage receptacle. Before washing your hands, remove all jewelry including rings and watches. If you have long sleeves, roll them up. Your arms should be bare to your elbows. Remember, stand away from the sink so your uniform does not touch it. Turn the taps on until water is warm and running. Adjust the flow of water to minimize splashing. Wet both hands and wrists thoroughly. Remember, at all times, do not touch the sink. It is considered dirty. Pump liquid soap and apply to palms. Keeping elbows up and wrists down, lather soap and rub hands together palm to palm. Right hand over the left hand, fingers interlaced. Left hand over the right hand, fingers interlaced. Doing this will create a good lather. Rub tips of fingers of left hand into opposing palm. Rub tips of fingers of right hand into opposing palm. Clean under the fingernails with one of your fingernails from another hand and repeat with other hand. Rub left thumb clasped in right palm in rotational manner. Do same for right thumb. Rub left wrist up to forearm. Rub right wrist up to forearm. Rinse both hands thoroughly under the water. Remember, keep your elbows up and wrists down. Water should flow from the arms down to the hands. Rinse until all the soap is gone. Remember, do not shake your hands. Let them drip. Take paper towel and starting from fingertips, pat dry in one direction only towards elbows. Remember, pat dry in one direction. This is in keeping with the principles of clean to dirty. Discard the used towel in the garbage receptacle. Take new paper towel and repeat until hands are dry. Ensure that the area between the fingers are dry. Remember, do not roll paper towel into a ball as it will recontaminate your hands. Take clean paper towel and use this to turn off faucet. Discard used paper towel immediately into the garbage receptacle. Stop. Note if your hands, wrists, and forearms are dry before you move on. The actual washing of your hands should take no longer than 15 to 20 seconds. Sing happy birthday twice or hum the ABCs to ensure you wash your hands long enough. Hand washing is the most important element of preventing the spread of infection. Hand washing, whether it be with soap or water or with hand sanitizer, must be done before or after any client care. When supporting clients, hand washing may be indicated in these instances: within the procedure, before and after removing gloves, or when handling soiled linen or clothes. If hands are not visibly soiled, it's okay to use an alcohol rub or hand sanitizer. In the following segment, using a hand sanitizer will be demonstrated. Gather your equipment and supplies. In this case, all you need is a hand sanitizer. Before using hand sanitizer, remove all jewelry, including rings and watches. Pour or squirt 1/2 to 1 teaspoon of hand sanitizer onto your hand and rub palms together. Spread the sanitizer and scrub your hands by rubbing palms together. Interlace fingers and continue to use friction to work hand sanitizer in. Rub thumb with wrist and repeat with other side. Rub wrist and repeat with other side. By now the sanitizer should be absorbed and your hands are dry. There is no need to dry hands with towels. Remember, the time frame is a minimum of 30 seconds or until your hands are dry. When the hands are dry, you are ready to begin providing care. Donning and doffing PPE. Infection prevention and control also includes wearing personal protective equipment, also known as PPE. It is the responsibility of the healthcare provider to know which equipment is needed before providing care. Isolation signs may also provide details on equipment needed before entering a client's room. Always check the client's care plan before beginning any procedure. Look for special instructions. Check for the description of client's abilities and limitations. In the case of caring for a client on isolation, know which protective equipment you will need to have on hand. Before beginning this procedure, gather your equipment and supplies. In this case, isolation gown, surgical mask, gloves, goggles, and hand sanitizer. Remember, the equipment you use is dependent on the level of precaution required. Before beginning this procedure, wash your hands or use hand sanitizer following the steps in the previous segment. Decide which one is most appropriate for this particular situation. Donning of PPE to take place just outside the room of the patient who is on isolation. To don equipment, use a new or clean gown. Pick it up and let it unfold naturally in front of you. Do not shake the gown. Put your hands and arms through the sleeves. Tie the neck strings at the back of the neck. Tie the waist strings at the back. Ensure the gown is wrapped around your uniform, covering the front and back completely. Stop. If you are required to use an N95 respirator, know the size you have been fitted for, and refer to the agency policy redonning. Before applying the surgical mask, ensure you have the colored side on the outside and pleats facing down. Secure the ties or elastic bands over your head, ears, and neck. Band should sit on middle of the back of the head. Pinch the nose with one hand and pull mask down so it fits snug around the face and chin. Fit the flexible band to nose bridge covering mouth and nose. Remember, ensure there is a good seal against your face. Place goggles over face and eyes and adjust to fit. Pull sleeves of gown down over wrist. Put on clean disposable gloves. Extend gloves to cover wrists of gown. Remember, while you have PPE on, keep hands away from your face. Limit touching surfaces. If necessary, change gloves when torn, contaminated, or heavily soiled. Acronym to help you remember the sequence for donning: HGMGG. H for hands, G for gown, M for mask, G for goggles, and G for gloves. Or Harry got Mary gorgeous gems. Doffing should occur inside the patient's room as close to the exit as possible. The sequence of doffing changes based on where you tied the gown, in front or back. If the gown was tied at the front, untie the gown ties first, then remove gloves. Stop. If the gown was tied at the back, remove gloves, then untie the gown. Grasp outside of one glove with opposite gloved hand and peel off, turning the glove inside out as you pull it off. Hold the removed glove in the remaining gloved hand. Slide fingers of ungloved hand under the remaining glove at the wrist. Peel off the glove over the first glove, containing one glove inside the other. Take care not to touch the outer surface of the glove. This is a contaminated area. And discard in the garbage receptacle. To remove gown, unfasten ties if at the neck and back. Allow the gown to fall away from the shoulders. Touching only the inside of the gown, pull away from the torso. Keeping hands on the inner surface of the gown, pull from arms. Turn gown inside out. Fold or roll into a bundle and discard. Perform hand hygiene. To remove goggles, handle by the headband or earpieces, and lift away from the face. Place in a designated receptacle. Grasp the neck ties or elastic, then the top ties and elastic, and remove. Avoid touching the front of the mask. This area is contaminated. Discard mask in the garbage receptacle. Remember, stay in the client's room until you have removed all PPE. Stop. Perform hand hygiene after leaving the isolation room. The acronym to help you remember the sequence for doffing is TGGHGMH. T for ties, G for gloves, G for gown, H for hand sanitizer, G for goggles, M for mask, and H for hand sanitizer. Or, thank goodness, Gorgeous Harry got Mary happy. After all procedures are completed, ensure that you do proper hand hygiene. Ensure also that the client is safe and comfortable by putting the following safety measures in place. Lowering the level of the bed, make sure that the bed rails are up, and providing the client with the call bell. In addition, ensure that all of the privacy measures have been removed. Clean and return equipment to the appropriate places. And lastly, document the care that you have provided, how the client tolerated it, and any observations that you have made.